Very much. Dr. Sanjay Seth, Honorable Minister of State for Defence, Government of India, Dr. Anil Goyal, Member of the Legislative Assembly, Delhi, Dr. Sareen, the Director of ILBS, Dr. Daga, Dr. Hanuman Prasad, doctors and staff and nurses from ILBS, and ladies and gentlemen. It's an honor and pleasure for me to speak to you all on this occasion of the World Cancer Day. In the WHO Southeast Asia region, liver cancer ranks as the fourth most common cause of cancer deaths, with over 103,000 deaths estimated to have occurred in the year 2022. We have 10 countries in the region, and in 4 countries, it is among the 2 top leading causes of cancer deaths. The number of new cases estimated in the region was over 107,000. The incidence and mortality in the region are estimated to be more than double, which is going to be more than double by the year 2050. So these are signals for us to see how we can try to prevent this from happening. And I do remember last year when I had visited ILBS for a different occasion. I remember Dr. V.K. Paul, who had estimated that in the next 15-20 years, the number of people requiring liver transplantation is going to double. And we do not have the capacity and the resources. So we need to act now. So this is something, I think it's a wake-up call. It's not too late, but we need to act. The overall mortality to incidence ratio for this region is estimated to be over 96%, and that's very high. Part of the reason for this high MI ratio is due to the aggressive nature of the disease. It is also due to the gaps in services for early detection and provision of treatment. This year, the theme of World Cancer Day, United by Unique, emphasizes that while cancer is a global threat, each country, each community, and each person affected by cancer faces distinct reality. Our approach to cancer care and cancer control should be holistic, covering the entire cancer control continuum from prevention to early diagnosis, treatment, and palliation. It should also be aligned to the other programs of the health. The complexity of cancer control requires that we join forces together in developing our responses. These should then be adapted for implementation locally. Liver cancer is the one typical example requiring such coordinated and holistic approach. Cancer control in the WHO Southeast Asia region is guided by the WHO Southeast Asia Regional Strategy for Comprehensive Cancer Prevention and Management 2024 to 2030. To ensure integration and holistic care, the strategy advocates for establishing an effective national coordination entity to govern the implementation of national cancer plans. The strategic priorities in the regional strategy relevant to liver cancer includes greater than 90% coverage for hepatitis B vaccination, birth dose as well as the 3rd dose, and increasing access to treatment of hepatitis B and C, strengthening early diagnosis and referral of high-burden cancers, scaling up capacity for cancer management with quality improvement, assessing burden, monitoring trends and outcomes, and lastly but quite important is to build partnerships. WHO is supporting the member countries in cancer control through identification of priority gaps and providing contextual recommendations, drafting of national plans, and technical support for implementation of the plans. To promote cross-country institutional collaboration, CRO has established a network of key cancer service provider institutions, the Southeast Asia Cancer Grid, and I am pleased to note that ILBS has been nominated by Government of India as one of the members in this network. Efforts, there are persistent gaps. It is clear to all of us that to address the challenges posed by the rising burden of liver cancer and emergence of risk factors, including metabolic dysfunction associated steatotic liver disease, collaboration is essential between a wide range of stakeholders, including governments academia, development partners, professional and civil societies, collaboration becomes more relevant. On this day, we call all the stakeholders for collaboration to synergize our efforts in implementing this evidence-based interventions and in governing newer evidences that are contextual to the needs of countries in our region. The role of institutions like ILBS is crucial in establishing a system for holistic care through multiple areas of the strategic priorities in liver cancer control. As a WHO collaborating center and a Southeast Asia Cancer Grid member, I am confident that ILBS will contribute to and lead many aspects of liver cancer control by collaborating with WHO member states and the fellow institutions in Southeast Asia region. I again like to thank the organizers for providing the opportunity to WHO to share our thoughts on this important event. Thank you.